metformin because unfortunately, since all the diet and exercise changes you've made in your life haven't been working, even though you put in a lot of hard work. So anyway, you'll be taking these twice a day. Remember, blood glucose 4 to 8, feeling great? That's where you want to keep it. Questions? Okay, bye!
Hey, can I talk to you for a second? One sec. Shouldn't you have implemented evidence-based practice and educated the patient about her new medications and provided at least one source of written information on her diagnosis and her medications for her to take home?
No, I think she's fine.
Let's look at the research that shows that patient education influences diabetic patients' adherence to their medications.
Nurse Awesome, that's a great idea. Self-management is key to the maintenance of a high quality of life after being diagnosed with diabetes, and Alcazaz et al. Found that reduced knowledge of the diabetes disease process was correlated with a lower adherence to a medication regimen. In addition, Sparrow-Helen et al. Found that patients with type 2 diabetes had improved control over their short-term blood glucose levels after receiving individual diabetes education. Patients who were educated on an individual basis also had better behavioral and psychosocial outcomes and higher patient satisfaction as well. So, what are the clinical implications of this data, you ask? Well, we want to be giving the right diabetes education to our patients, as this is directly linked to their long-term health outcomes. As a nurse, you might feel like you're not implementing a skill-based technique, but by educating our patients, we're empowering them to take control over their own health. Additionally, we have to remember to really take the time to talk to our patients and listen to their questions. Everyone comes with different barriers that might prevent them from adhering to their medication regimen, and these should be addressed in order to maximize adherence.
Thanks, literature and magic voice. Now do you see why it's important to slow down and educate our patients?
Oh, I almost forgot to take my blood glucose levels. My blood glucose is at 7.5. It's between 4 and 8, and I feel fine. I know I'm supposed to take my metformin, but if I'm between the levels, I don't think I need to take it. It's not like I'm going to go into a coma from this one donut.
OMG! Flow!
There are a few pieces of information about your new metformin medication that we didn't go over properly earlier. This medication should be taken at the same times each day, never double up on doses, and if you miss a dose, take it as soon as you remember, or if it's almost time for your next dose, then take the next dose and just skip that dose. Nurse Awesome, did you have anything else to add to that?
Even if your blood glucose is within a normal range, you still need to take this medication. This just means that your metformin is being effective. Diet and exercise is also important to help prevent hyper and hypoglycemic episodes. I have some information for you to take home on that. A side effect of this drug is not usually hypoglycemia, but more likely lactic acidosis.
What's lactic acidosis?
Lactic acidosis is when lactic acid, a byproduct of your metabolism, builds up in your blood and in your muscles. Symptoms of this are chills, diarrhea, and dizziness. I have some information on that you can take home.
Yeah, thank you.
Are there any more questions?
No, I'm glad you clarified the need for me to take my medication at the same time every day, even if I'm 4 to 8 and I'm feeling great. These handouts are very helpful, and I'll call the clinic if I have any questions. Okay.